everyone, and welcome to today's Facebook Live with GBMC Healthcare. Now, today we're talking about expanding the role of radiation when treating metastatic cancer. So let's welcome our guest, Dr. Matthew Boyer, radiation oncologist at GBMC Hospital. And remember, we want to hear from anyone watching, so please don't hesitate to ask us your questions. Now, welcome, Dr. Boyer.
Thank you. Thank you for having me.
All right. So first, we hear cancer, right? But what is the difference between cancer and metastatic cancer?
Well, metastatic cancer really simply means that the cancer is spread from one part of the body to the other.
Okay.
And what we're hopefully going to be talking about today is how we can improve the outcome of patients with what we consider a limited extent of metastatic disease.
Okay, and so how is that with radiation therapy?
So it is, and when patients are typically diagnosed with cancer, they're given a stage, 1, 2, 3, or 4. And to put it in sort of a framework of how we can think about things, we like to find patients, if they unfortunately are diagnosed with cancer, with early stage disease by doing mammograms or colonoscopies.
Okay.
But unfortunately, there are going to be patients that present with more advanced disease.
Mm-hmm.
And so there is a term that's used, locally advanced cancer. So that's cancer that started somewhere and has spread to some of the lymph nodes that are nearby, or maybe has grown particularly big where it is. And then metastatic disease is sort of the end of that spectrum, where it's started to grow in one spot and maybe spread to some lymph nodes, but then also spread to other parts of the body.
Okay, and so are there certain cancers that tend to metastasize more than others?
Given enough time, unfortunately, I think most cancers will spread. There are cancers that have a predilection for one spot over the other. Lung cancer, for example, can spread to the liver, maybe to bones. Breast cancer can also commonly spread to the bones as well, prostate cancer to the bone. But what we're really looking for are these types of cancers that have a limited burden, or these patients with a limited burden of metastatic disease.
Okay, and so is that one of the factors that then determine the treatment options?
Yes, so what we're going to be looking for, and there's not a clear consensus on what exactly defines this state, but what we're looking for are patients that have probably at the most 5 different metastases, 5 different tumors in other parts of the body.
Okay.
And they can be diagnosed that way, or maybe they have already been treated for a cancer sometime in the past, and now the cancer has come back. Okay.
So when you say 5 different spots, would it be 5 spots in one area, or could it be all spread around?
So could it be all spread around?
Okay.
It actually makes a little more sense and is a little bit technically easier for what we do if they're actually spread around.
Okay.
Because we worry about the volume of them as well too, sort of the amount of normal tissue that we would need to treat with radiation goes along into that thinking as well. But we want to see that it's something that we can target with the radiation and certainly not cause too many side effects for the patient.
Okay, so when we hear cancer, right, we automatically think chemotherapy. Talk to us about some of the other options, I guess radiation, that are available for people with metastatic cancer.
Sure. Certainly the backbone for metastatic cancer is chemotherapy, and it has been for a very long time. And so we're not saying that this is a replacement for it, but we're trying to integrate radiation along with chemotherapy in one way or another, or maybe even these days what we consider systemic therapy that are more targeted agents than traditional chemotherapy, but integrating radiation with those to affect some positive outcomes for these patients.
Okay, so walk us through it. Somebody finds out that they have cancer, it's metastatic, and they walk into your office. What happens next?
Well, I think before they even see us, the best part about working with the doctors and the different oncologists and physicians at GBMC is that we have multidisciplinary meetings and groups that discuss every patient before we actually come into our office. So we have a chance to kind of make sure that the medical oncologist who would prescribe the chemotherapy understands what our role might be, and we understand what their role might be.
Okay, and so that's important. So just explain that to everybody who is watching again. So before they even come into your office, there have been a meeting of the minds of all of the professionals that they'll come in contact with.
Yeah, so often we are actually on the bottom of the totem pole. So most patients who with a new diagnosis will get referred to a surgeon or maybe referred to a medical oncologist. And it's typically them that will bring sort of the patient to the tumor board, bring their case. And so we have a chance to go over some of the tests they've had done, like a biopsy to define this as a cancer, or maybe some imaging studies to get a sense of where the cancer actually is, to come up with a good plan in terms of how we treat them.
Okay, and so then once you come up with that plan, what does it usually consist of?
Well, so we are looking for patients that we can give what we consider a targeted or an ablative dose of radiation treatment. And typically that means targeting the tumor itself with just a little bit of extra tissue around it over a very short course of time.
Okay, and so how does that work? So somebody comes in and are they on a table like an X-ray when they come to get radiation?
Yes, so when they come in, we actually go through sort of a simulation, as we call it, or it's really just a dry run of how we're going to do the treatment. So we need to be able to kind of identify the cancer and make sure that we can get the radiation dose that we need to it safely. So that would be the first step, sort of a practice about how they're going to get treated. We certainly also in that time frame want to make sure that they're comfortable about how they're laying there and can get back in that position when they come in for treatment.
Oh.
And then certainly after that, we go through a planning process to decide how we can align the radiation. We work with a number of our members in our group. There are physicists that work with us, dosimetrists who help design how the radiation comes in and how the dose gets distributed. And then they come back in for treatment about 2 weeks later.
So what is the radiation actually doing? Is it killing those cancer cells or shrinking or what? What is it doing?
The radiation treatment that we use is an X-ray. It's just like coming in to get an X-ray or a CT scan. But biologically, it is transferring energy to those cells, those cancer cells, and it's causing some damage to their DNA. And some of those cells will die kind of right away from that. Other cells, when they try to grow or divide in the future, because they've suffered so much damage, they can't. And we hopefully, a combination of that will make the tumor shrink down and go away.
Okay, makes sense. So how long is each radiation treatment?
Each day you're probably there for about 30 or 40 minutes. Some of the time is really just waiting for your turn and getting changed into a gown and getting in the right position. And most often patients are getting treatment, the actual radiation is being delivered over less than 10 minutes.
Okay, so what if the cancer hasn't spread? Can you still get radiation as an option if you have cancer?
Sure, and these vary a lot by different sites. So, for example, for lung cancer, if you have a lung cancer that's found at an early stage where there's just a tumor in the lung, radiation is a very attractive option instead of surgery for a good number of patients, where we can do this sort of focused treatment, just the tumor, very few side effects over a very short course of time. Other cancers, depending on exactly how we treat them, can be longer. There can be 5 up to even 6 or 7 weeks of treatment.
Okay, and so you talked about how long it is. How long does it last as far as how often do people come?
Well, so in the instance where we're treating, let's say, a lung cancer with a very focused dose of radiation, or we're treating these patients with metastatic disease with a very focused dose of radiation, that treatment is usually done over 5 days. So it's 5 treatments that you would come in for.
Okay, and so then what's some of the benefit that you've seen from radiation therapy?
So a lot of it now, there's some early studies going on in using radiation therapy in the metastatic setting or patients with metastatic disease. It is unfortunately somewhat of a select group of patients because we're looking for those with a limited number of metastatic sites. But radiation has been shown to improve how long it takes for the cancer to start growing again. And actually in some studies it's been shown to prove how long patients live by a somewhat dramatic degree. And so there are bigger studies ongoing now to try and expand that role somewhat and more definitively prove that that is indeed the case.
Are there any side effects?
They are a little bit specific to where exactly we're treating. I think everybody that gets radiation gets some fatigue to some degree. It shouldn't keep the patient in bed or stop them from what they want to do during the day, but may feel less energy when they're up and about. And then it just depends on exactly where we're treating. So for a patient that has a lung cancer or a lung metastasis, it's possible that we could affect their esophagus, so they may feel like a heartburn sensation or a reflux type feeling. That's very temporary, goes away pretty quickly after we're done. And we almost never affect anyone's breathing to the point where they would get like a cough or a feeling of like a bronchitis or pneumonia. Very rare that it does happen, and it goes away actually with treatment.
Okay, so talk to us again about the difference between radiation and chemotherapy.
So radiation is generally being used, or can sort of think of it as a local treatment. So radiation is usually directed to a tumor or an area that we think is at risk for the cancer spreading to. Chemotherapy, on the other hand, is more of a systemic treatment. What that means is a treatment that goes throughout your body. So chemotherapy is often delivered through an IV, and it's something that can affect the cancer wherever it may be. And so when you think of the side effects of treatment, chemotherapy can cause side effects in a lot of different parts of the body because it's just there. whereas the radiation is really targeted or directed to one spot or one area of the body.
Okay, so what kind of recovery is needed once you go through all of your radiation treatments, they're complete? Then what?
There's really not a recovery time.
Okay.
So, patients are up and about and doing whatever they would normally do. And I think that's one of the benefits of going through radiation treatment as opposed to, let's say, surgery, where there can be some downtime for that. And most patients, if they are, let's say, going through chemotherapy as part of their treatment, can just get right back and into their chemotherapy that they've been taking.
Perfect. All right, so talk to us about immunotherapy. Does radiation therapy integrate with that as well?
So it does, and that's an area of active investigation about how to integrate the two. Okay. So immunotherapy is something that is there to help your body's own immune system become more active against the cancer. And there have been some great results just with immunotherapy by itself for a lot of different types of cancer. Melanoma is certainly the one where it was sort of introduced first, but it's been used in lung cancer and quite a few number of other cancers. What we think along with radiation is that the radiation could possibly make the immunotherapy work a little bit better, meaning that the radiation would cause some injury to these cancer cells, make them appear more foreign to your body, and just make your immune system a little bit more active, and the immunotherapy only boosts that even further.
Okay, so talk to us again about what's different about GBMC, how the doctors there, the tumor board, you come together and you discuss each patient.
Yeah, so I think we have, we do have a number of different integrated tumor boards. We have one that meets for GYN cancers, one for breast cancer, one for thoracic or lung cancers, one for head and neck cancer, one for GI cancers. So we have just about everything covered, and I think we have the ability to bring together not only the treating physicians, but the radiologists who would look at the CAT scans or PET scans that patients have done, the pathologists who may look at the biopsy results, and then some other, certainly very important members of our team, like physical therapists, speech therapists, that can be important in terms of how patients do during treatment and how we can address the side effects that may come up.
So is that one of the ways that GBMC's treatment is different than other places?
Yes, so it certainly is. I mean, I think we do a great job of kind of integrating all of those specialties up front before these patients, and can be proactive in terms of how we treat them. I think in terms of the technology that we use specifically to radiation, we have what we consider what we call linear accelerators in how we deliver the radiation. And we certainly have a way to target a large number of cancers.
Right, so finding out that you have cancer is scary, right? And so it certainly involves not only the patient, but their whole family. So how do people respond once they come to you and that they realize that you guys have such a system in place where every side effect that they could possibly have, down to physical therapy, is kind of all taken care of?
Yeah, so it certainly is a scary diagnosis. A lot of that is a little bit of the unknown. Some of it is sort of the information that you can find that may be unfiltered on the internet. And I think once you have a chance to give the patients more information about exactly what's going on, what we expect from the treatment, and how we can manage everything is very important to them, and helps them at ease in terms of what the treatment will be and what the future will hold.
Right, and you guys offer support services for the whole family, right?
Yeah, so we do. There's a number of different ways in which we do support the patient and their family. One can be, there is a support services, it's oncology support services, and they address a lot of different factors. Coming to treatment every day for, let's say, 5 or 6 weeks can be particularly burdensome for someone who doesn't drive or relies on public transportation. That's something that they can help with. There's support groups that meet throughout the city that those groups, those people are plugged in with. And certainly, we have other members of the medical team. We have an integrative medicine approach as well. So we have a doctor and a couple practitioners with her that do a great job in terms of addressing the whole patient.
Okay, so if somebody is watching at home and they want to reach out to you, how do they find you? How do they get an appointment?
Sure. So one way is certainly to look on the GBMC website. We are under the radiation oncology group, and we'd be happy to coordinate any care with us, or if it's not appropriate, with maybe a surgeon or a medical oncologist. You can certainly call us directly. Our number there is 443-849-2540. And typically you can see patients within a few days. to get things coordinated about the next steps in their care.
Wow, a few days, because that's also important, right? That's a big deal for people to be able to call and get right in.
Yes, so we are, sort of a subspecialty, so to speak, and so, when, patients typically interact with some other healthcare providers, there can be a delay in weeks and unfortunately sometimes even months in getting seen, but we, are going to do what we need to do to get patients seen in a timely manner.
All right. Well, Dr. Boyer, thank you so much for being here with us and breaking down everything. Truly important information. Thank you guys for joining us as well. All of the information, again, they're available on the bottom of your screen.